Today's public presentation provides us with an opportunity to engage directly with the communities we serve. We are committed to public and patient involvement in helping to shape the services we offer the people of Fife. Listening and learning from the experience of patients, carers and service users is crucial in informing many of the service enhancements and future developments you will hear about today. In a moment, NHS Fife Chief Executive Paul Hawkins and members of his executive team will present an overview of our performance over the past year. However, before I ask Paul to do so, I would like to invite the Minister, Claire Hawkey MSP, Minister for Mental Health, to say a few words to you. Thank you.
This review is an annual event aimed at discussing how effectively boards have delivered local services in the preceding year and exploring developments and challenges over the next year. It's part of the process of holding boards to account for expenditure of the large sums of taxpayers' money that's invested in NHS Scotland.
Over the last 18 months, we've done significant work in reconfiguring the acute services in terms of how it operates for both medicine, elderly care and for surgery. We now have a 23-hour stay ward for surgery in Victoria, as we do at Dunfermline as well. We've established a new eye theatre in Dunfermline to increase access to ophthalmology patients, and we've recently had agreed a submission to Scottish Government for 3 orthopaedic theatres and a new ward at Kirkcaldy to move the orthopaedic element from the tower into a new development. So that's very, very positive in acute services. So we've recently been piloting something called Snap 40, which is a system that will operate in people's houses, a bit like a telemetry system that you'd perhaps see in coronary care units, where it highlights when people need support. Hopefully in the future that will start to demonstrate when somebody needs a district nurse and when they need a call, rather than arriving at an A&E or calling for an ambulance. So lots of different ways of starting to look at things, which is really positive.
So if you look at our 4-hour emergency access, clearly if someone's acutely unwell coming into hospital, it's very important that they're seen and treated and either admitted and discharged within the standard, which is 4 hours. Fife have done particularly well on that standard consistently, and in the last year they were at 95.1% when compared to the Scottish average of 92.2%. Clearly that means that people within Fife are being seen by a specialist in hospital faster than perhaps is happening in other places, which is good given the challenges that the emergency pathway continues to be under. If we then look at outpatient waiting times, again, NHS Fife do much better for their patients in this arena, with 93.5% of people actually seen within the standard waiting time of 12 weeks. That is significantly better than the rest of Scotland, and I think that it's important that we understand that for whatever reason within Fife, we are ensuring that our patients are seen when referred and seen early, and I think that's very good in terms of patient care. In terms of the cancer standard, clearly that's really important. If you're a patient that's got cancer or you're a relative of a patient with cancer, then it can be a very stressful time. Again, I think it really gives me a lot of pleasure to say that within Fife we do actually exceed the 95% standard. 98.5% of our patients are actually seen within the 31-day guarantee, which again is above the Scottish average of 94.3%. So I think our staff can be quite proud of the fact that they actually do manage to deliver not only what is expected, but actually manage to do slightly better than that.
In terms of our review of key performance indicators, I am delighted that in relation to children and adolescent mental health services, that the approach we put in place over the last couple of years is paying off. We have seen significant improvements in waiting times performance for children and young people needing specialist mental health support in the last year. As of December, we were meeting the waiting times target for 85.5% of children and young people needing those specialist services. It's a tribute to the staff of the service. We have invested to improve the service, and we've also invested in capacity to bring waiting lists down to ensure that those who do need the highest tier specialist CAM services, as we call them, are seen as soon as possible. We're also improving our ability to support adults through our psychological therapies service. We're making progress there, but we're also redesigning that service, ensuring that we can support more people in the community, because that is really crucial to our success. Allowing specialist clinical services for those who need them is our key strategy. Fife also does well on meeting waiting times for those requiring drug or alcohol services. Our performance last year was 96.3% compared to a Scottish average of 93%. We're also making good progress, I'm pleased to say, on smoking cessation, focusing on quits in our most deprived communities, and we're confident we'll meet our target for sustained quits this year, which is the first time for 2 or 3 years. We did a significant consultation last year and joined up care in communities. Paul referenced that earlier. One of the things we discussed there was the future of out-of-hours GP services, and we're doing further engagement on that, and we hope to have a plan for a clear way forward for those services in the first half of 2019.
In terms of patient feedback and complaints, and you'll see that on the next slide as well, we've implemented the new National Complaints Handling System, and this year's focus will particularly be around about the 20-day response target, which we started to review within the complaints process. Care Opinion is an internet-based system which gives instant feedback for patients and families, and it's been really successful across NHS Fife. In fact, we're the 7th highest board in the UK for Care Opinion in terms of engagement. A lot of our data we use has been really helpful. We know that 75% of the responses that we get are very positive, and the 25% that aren't as positive, we work with the families and carers to take that forward and take out actions from that. The next item there is the standard UNICEF accreditation for our baby friendly. And I would like to say this is a really prestigious award, and we were given that last year as part of the Baby Friendly Award. The Baby Friendly Award looks at all standards of care for mums, dads and babies within our midwifery services. And it focuses particularly around infant feeding and relationship building. I would also like to say that this week alone, we're going for what we would say is going for gold. And if we get that this week, we'll be the first board in Scotland to have achieved that with UNICEF. And finally, my last bullet point sums up a huge piece of work, 10 years of the Scottish Patient Safety Programme. We celebrated an event with all our clinical staff this year, where we looked at the work that had been taken forward across NHS Fife over the last 10 years, and it was astounding. We've seen excellent results in reduction of our cardiac arrest rates, ventilator-associated infection, falls and pressure ulcers. A really good piece of work.
I'm really pleased to see that we have some really good work going on around vaccination and immunisation. And in 2016-17 we had our flu vaccine for staff was around 26%, which is really quite low. And then the year after that we got our flu vaccine rate up to 57%. And this year we're aiming for our 60%, and we're very, very hopeful that we will achieve that within the next few weeks. There's very little in the world of public health that's done in isolation, so we always work with others. But our focus in this coming year, or coming 5 years probably, is to deliver the plan for Fife and our public health priorities for Scotland. So we will have a focus on increasing income, we'll have a focus on ensuring good employment, good housing, and addressing some issues such as fuel and food insecurity. And that is the areas of work that we'll be taking forward.
Our embedded workforce planning arrangements, which are crucial to the board because, like every board in Scotland, we are facing and will face in the future workforce challenges in terms of getting the staff that we need with the right skills at the right time. And we are using this opportunity of embedding our workforce planning arrangements linked to our services, linked to our financial planning, to look at how we may use new technology, develop new roles, and also support developments in relation to focus work that we are doing and continue to do for those of our staff who are getting near to the end of their career that we want to sustain in employment because they have valuable skills. And we started work on that and will continue to do that this year. We also developed good relationships with our 18 high school coordinators to increase the opportunities for youngsters within the board in terms of being an employer of choice in the future. We've increased the level of general placements, and we've also increased the level of placements for observational placements for those interested in medicine and nursing. And we have just completed, with the support of our AHP and other colleagues, a really successful face-to-face event with over 200 S2 pupils within Fife. Turning to our workforce, it's very, very important to the board that we get feedback from our staff, and we achieve that through our staff engagement tool, which is iMatter. That allows our staff to tell us how they feel about working in Fife, how they feel about working in their teams, but also empowers them to actually change things within their local teams that make their working environment better. And we were the first board to actually adopt iMatter, not just across health employed staff, but also our 5 council colleagues and employed staff within the Health and Social Care Partnership. And that was actually a really, really positive and very beneficial, and actually a really, really successful thing to do. Turning to proactive recruitment, and I mentioned previously the workforce challenges we face just now and will face as we go forward. We have just recently recruited over 100 nurses and 20 midwives as a result of the very active work that Helen and her senior nursing team have done, liaising with universities. And that is no mean feat in these days when all boards are looking to get staff from the same areas. And we are the first board to develop in partnership with St Andrews University Medical School, ScotGem, which is actually a dedicated training course to attract and train GPs of the future. Again, which is a really, really positive and something that we should be proud of.
Despite starting with an initial shortfall in our income of £29 million, we were able to deliver a balanced budget in 2017-18. In 2017-18, we benefited from some one-off underspends at the year end, and that included the impact of an arrangement that we have between ourselves and Fife Council in terms of managing the financial position of the Health and Social Care Partnership. We had also planned some expenditure in the last financial year that was delayed, and that included the NHS Fife contribution to, for example, the new Children's Hospital in Edinburgh. And those underspends helped us to offset some shortfall in savings in other departments and services in Fife. Through our capital funding of £8 million, I'm delighted that we were able to improve a number of our buildings and also to invest in new and replacement medical equipment and also IT and technology. And I'm very pleased to say that Audit Scotland, who are the independent body that scrutinise our financial statements and also the way that we manage our money, they provided an unqualified opinion on our annual accounts for 2017-18, which you may have heard described as being a clean set of accounts.
Care continues to evolve for the 70th anniversary of the NHS. Who would have thought we would have been here now in 1948 with a very, very different service. Fife also continues to pioneer in Scotland. You've heard issues around 24-hour HIPs. First in Scotland, pushed forward by our orthopaedic surgeons. We have very engaged clinicians. We've now moved forward with urology lift technique, which has improved our cancer targets within 3 months of it being implemented. So always looking at the technical edge of what we can do. And we do not need to be a tertiary board to do that. On behalf of the board and myself, I think we're fiercely proud of all the clinical staff and staff at work in NHS Fife, and I personally am really glad that I've got the directors around me that can do the sort of work that gets us this performance. So thank you very much.